Bismillahirrahmanirrahim. Welcome back friends, welcome back to another video lecture by Kami microbiologist. I hope all of you are well and fine. Today in this video lecture I am going to explain another video that is related to the vitamin profile, and it is about the vitamin K blood test. If you guys remember, we already talked different vitamins test, like we have talked vitamin A, vitamin B, different types of the vitamin B. We talked vitamin C, vitamin D, vitamin E. Now this is another video that is regarded to the vitamin profile, and it is about the vitamin K blood test. If you miss all the video lecture that is regarded to the vitamins, so you can go back to my channel and watch the playlist of the vitamin profile test. Okay, today I am going to explain vitamin K blood test. My name is Muhammad Kamil Khan. Are you guys watching my channel Kami microbiologist? Let's start the video. In this video, what are the main content that we are going to explain? First of all, we will see that what are vitamin K and what is function of vitamin K, what are the diagnostic purpose of the vitamin K test, what is the test procedure, deficiency of vitamin K, normal range, main causes of high and low vitamin K. Let's see the introduction. First of all, the vitamin K is also called as clotting vitamins. Why? Because it is really important in the clotting, because it can stop the bleeding by providing different clotting factors or synthesize the clotting factors. Next, vitamin K is also the part of the vitamins, mean it is a type of vitamins. Vitamin K is actually the fat soluble vitamins. Vitamin K are also the essential as well as the non-essential vitamins, means we can obtain the vitamins from the food, as well as our body can also make and store the vitamin, like we have liver, bone, heart and pancreas. Now these are the organ where the vitamins can be synthesized and stored. Now if we see the normal range of vitamin K, so it is 0.2 to 3.2 nanogram per milliliter. Now let's see the types of the vitamin K. So we have three types of the vitamin K. The first vitamin K is the vitamin K1, we call it phyloquinone. It is found in the plant-based foods. Next we have vitamin K2, we call that miniquinones, and it is found in the animal-based food. Third we have vitamin K3, we call it menodoins. It is the synthetic form, or we can say artificial form of the vitamins. It can be synthesized and it can be used for the medical purposes. Let's see the function of the vitamins. So vitamins are important to synthesize different clotting factors, like we have clotting factor 2, 7, 9 and 10, which are important to stop the bleeding, and we can say it is helpful in the blood clotting. Next we have vitamins are helpful to prevent us from the prostatic cancer. Vitamins can also reduce the effect of aging. Vitamins are also important to secrete and maintain insulin and glucose level in the blood. Moreover, vitamins are also important to regulate calcium level, to make the bone strong and healthy. Next we have that vitamin can also important to make our heart healthy. Vitamin can also maintain the proper cell growth. So these are the function of the vitamin. Now let's see the main symptoms when the vitamin get low, or if there is vitamin K deficiency. So if there is vitamin K deficiency, there will be increased bleeding, blood in urine and stool, easy bruising, bleeding from nose and gums, heavy bleeding during periods, intracranial bleeding in infants. Now let's see the diagnostic purpose of vitamin K. So vitamin K tests are important to check the level of the vitamin K in the blood, either it get low or high. This test is also important and performed at that time when the PT value is abnormal. These tests are also performed to diagnose the issue regarding with bleeding. This test is also important to monitor the treatment efficacy, or to check the supplement efficacy which are providing for the treatment. Now let's see the diet rich in vitamin K. So we have cauliflowers, spinach, broccoli, lutein, green apple, kiwi, avocado, grapes, green beans, egg, cheese, olive oil, liver, and cucumbers. So these are the food. So in this, as you can see, a lot of vegetables contain vitamin K. Next we have the test procedure of the vitamin K. So first of all, you have to get the patient that the patient should be on fasting 12 hour. Then you will take the blood from venous and collect it into the heparin or AGTA or black top or blue top. Then what will you do? You will centrifuge the blood to get the plasma, and then you will run it on advanced machine like semi-automated machine, or we have Selectra, Mendray, we have in semi-automated we have Fine Care, Lofia. Now let's see the main causes of low vitamin K. So vitamin K may be low due to the cystic fibrosis, due to use of different medicine like warfarins and antibiotic, due to cholecystitis means stone formation in the gallbladder, due to liver disease, lactation and pregnancy, newborn babies, aging, poor diet, celiac and Crohn's disease. So these are the main causes through which vitamin K level get low. Then we have vitamin K level get high, so it is due to the supplements, more and more supplements of the vitamin K. So this is all about the vitamin K test. Thank you so much for watching. If you like this video, make sure to hit the like button, share this video and subscribe the channel to get more interesting video like that.